Hi, sir. Hello. Yeah, I can see sir here. Wait, guys. Yes, let us join. Let us join. Let us join. Okay. Wait. Can somebody from my team make him host? Yeah, I think now you're co-host, sir. You can go ahead with opening your mic. Yeah, yeah, sure, 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 sure.
Yeah, can you hear me?
Yes, absolutely. We can. We can. Okay. And are the others joined, sir? They have joined or not?
Oh, no, no, they're there. Manju's there online. Manju
Uh,
Kurth has joined us. Yeah, hi, Manju.
yeah, I have
Uh, uh,
her also co-host. Hi, Manju. Good evening from India. Hi. I think she is connecting with the audio. Yeah.
yeah, I think we'll have to disconnect with the audio as well. I think Dr. Keith is also online with us.
Not yet, I believe. Please raise your hand because I think it's very tough to find out in 155 people. We can search with the name, but still it's very tough. Please, you can. Okay. Amrendra Shekhar Pandey. Who is he? Is he in one of our speakers?
No, no, not today.
I'm so sorry. I'm so sorry. I'm telling our speakers to raise the hand. I'm so sorry, guys. Okay. Who else is our speaker here? Okay, Manju is here. Then I think Siva has not joined yet.
She will be joining us shortly.
Kirti, I'll just check. Okay, Kirti Vashan is here. Yes. Is it the correct
Not
name?
Kirti Varsan. It's Kirti J. Lakshmi,
Okay.
speaker.
Okay. Okay. So who else is there? Okay, Siva, Manju is here. So we are just waiting for Siva and Kirti, right?
That's right. That's right.
Yeah. Guys, don't raise your hands. We'll have the question answer sessions for sure. Don't worry. Everything will be solved and everything will be talked about, whatever we have mentioned. So don't worry. Okay. Please, you can put down your hands. It's fine. It's completely fine. Okay. So, sir, can you just confirm with them?
Yeah, Doc, I
Dr.
think they should
Devas,
be
I'm
joining us in a
perfectly
couple of
fine.
minutes. They should be
I'm
joining us in a
perfect.
couple of
I'm
minutes.
perfectly fine, guys. I'm perfectly fine. How are you all doing? Tell me. I'm great. I'm great. I'm doing great. You guys tell me how are you doing, everyone? Perfect. Perfect. I'm very, very, great and humble to see you all here. So we are waiting. People are joining, and right now, if I see, oh, there are a few peoples in the YouTube also. There are okay, more than 50 people are in the YouTube as well right now. I can see, yes, yes, yes. Good evening, everyone. Good evening. Good evening. Yes. So people will be joining in both the mode. As someone was writing here, YouTube is more convenient. Okay. Is it? No worries. That's fine. You can join anywhere. You can join anywhere. You all are completely free to join anywhere. Your feedback link, you will be hearing everything same. You can question from anywhere. Okay. Okay, guys. So yeah, we'll wait for one or two more minutes, and then we will start. We respect your time. We respect our time. We respect our speaker's time. So very soon we'll be starting in a minute or two, maybe. Okay. Yeah, there are 232. Okay, I'll just remind the people all again so they can join. Yeah, one second. One second. I'll just keep a message in the WhatsApp group. Mm. Good evening, everyone. Good evening. Lovely to see you all here. Lovely to see you all here. Yes. Join everyone, join. Okay, so there are right now. That's okay. Guys, please put your videos also off. I request all of you, please uh, put your videos also off, okay? Not only audio, but please put your videos also off, okay? Yeah, I'll just. Okay, Siva has not joined yet, sir. Any update, Kirti? No worries. So I think let's start. Let's start. Then let them join around. Say no worries at all. Okay, so guys, let's start. I think there are 300 people right now, and I'm literally overwhelmed to see you all here. Wonderful to see you guys. Wonderful to see you. Very nice, very nice. I'm literally happy to see you all. And right now, there are many people in the YouTube as well. Many people who are joining from YouTube. Thank you, guys. Thank you, thank you, thank you. Okay, so let's start. People, please, if you are not a speaker or then you can please put off your videos also because it can disturb the speakers and others. Please put off your videos. So otherwise my team will put off your videos. Okay. Mm. Guys, I have something which can put off everyone's video, but I don't want that, right? So I believe you will be listening to me and putting your videos also off. Why not? Yes, that's great. Thank you. Okay, guys, so let's start. Good evening, everyone, and I welcome you all.
Doctor, could
I
you unmute Kirti as well? Sorry for that.
No, she can unmute. See, Kirti is here. Okay, just let me see. Sir, what's her name? There is only Kirti Vashan coming in my search.
No, Kirti Jayalakshmi is there.
Where is one sec? Let me see. Kirti Jayalakshmi. Kirti 6 or what? Okay. Where is that?
In Zoom, yeah. 1 minute, Doc. I'm getting her online. Okay, she's coming in about 2 to 3 minutes. That's fine, Doc.
No
You
worries,
can
no worries.
carry on. Yeah.
We can make her the co-host later. That's okay. That's perfectly fine. So hi guys, good evening and very warm welcome to our free webinar, which is a wonderful topic, and I believe there's a need of our because of many of our students they want it and they requested me for a longer time. Let's do something on the international pharmacy licensing exam. Okay, so international pharmacist licensor exam. So on the trainings and career opportunities. So we are here, guys, with the webinar, with the big webinar. I'll not say just a webinar, but the big webinar with many experts from different areas, different countries to tell you about the international pharmacist licensor exam and training and career opportunities. And guys, I'm very glad to share with you right now that we have come up with something else, and we are launching today our CliMed Rx-Edu and CliMed Overseas, where you will be getting the entire platform to learn the therapeutics, clinical proficiency, and the entire training about licensor exams for different countries, whether you say Australia caps, whether you say USA FPG or NEPLEX, whether you say PEBC Canada, or whether you say DHA, MOH, or anything, any exam where you want to go, you will get all the resources at one platform, that is Rx-Edu, that is Rx-Edu CliMed. So we are partnering with Rx-Edu, and we have with us all the experts. And today we are going to talk about, in this 90 minutes session, we are exploring the intricacies of licensing procedures across the globe, different jurisdictions, and we'll be experiencing the first-hand launch of our exciting new collaboration, CliMed Overseas, which is partnering with Rx-Edu. Okay, so CliMed Overseas is our new launch, our new wing at the CliMed under the umbrella of CliMed, where we are partnering with Rx-Edu, and we'll be talking about all overseas, either that is career opportunities, that is pharmacy licensure exams, or whatever. So today in our webinar, we are uncovering the intricacies of licensing exams in Canada, USA, UK, Australia, and GCC countries during this comprehensive session, exploring the perfect platform to elevate your expertise in therapeutics, refining your clinical proficiency, and excelling you in international pharmacy licensure exams. We are also here to answer your all the questions, fostering these, in this interactive session about your all the questions and inquiries. Right, guys. So let me just give you a brief about our expert panel. We have Mr. Jacob Nicholas, sir is MPharm and registered pharmacist. He is clinical pharmacist, international MD, CH he has done, and he is the director training program at Rx-Edu, which CliMed is partnering with. So we are partnering with Mr. Jacob Nicholas with Rx-Edu for this wonderful platform for all of you. And today's in our panel expert, we have Manju Korothu. Miss Manju Korothu is from Canada. She's joining us from the Vancouver. She's a clinical pharmacist and for the psychiatry and substance abuses. We have Miss Siva Vins. She's also registered pharmacy for IPA and CD, which is certified diabetes educator and additional prescribing authorization. From the Canada, she's joining us, and we have Miss Kirti Jalaxmi. She's again PharmD, MSc and OSPEP, clinical pharmacist, mental health Glucosidone Sire Hospitals, NHS Foundation Trust, England. So these people, all experts are going to tell us about all the procedures and what are the career opportunities and how to go for the pharmacy licensing exams in these countries and how you can be master of that. And with that, I invite Jacob sir to tell us about this platform, because we are partnering with Rx-Edu, and we have come up with this partnership for all of you at the very cheapest rates, very cheaper rates as CliMed always offers. So that was my personal request to him, sir. If we are providing something to the students, if we are partnering, then you have to go to our level. And sir did that, sir accepted that, and you will get wonderful platform to learn. You will get a lot of things. And I'll not tell, Mr. Jacob will tell about this, and he will be introducing our next speakers also, who are going to talk about the countries and their pharmacy license exams. But guys, let me tell you, believe me, I'm here, CliMed is here. So your unbounded faith is there with us. Okay. And we are never breaking it. Right. So you are with us, I am with you. So it is 100% guaranteed platform to where you can learn everything. Okay. So with that, I'll not take much time. I'll just hand over this mic and the session to Jacob sir. Jacob sir, over to you.
Thank you, Dr. Ajit. Thank you for the wonderful briefing. Thank you for this gathering as well. It's amazing to see such a lot of pharmacy professionals across India, and I guess we also have people from Africa, a
Absolutely,
couple
yes.
of people from Middle East joining us as well.
Yes.
So it's wonderful, and thank you for this platform. And very good evening to all you learners. I would like to call you as learners who have joined us today evening. So it's wonderful. So let me just take about 5 minutes or maximum 10 minutes before we have the other speakers join us as well. So it's been about 2.5 decades, I would say. That's a long time, 25 plus years in this in the pharmacy field, exploring various areas of community pharmacy, areas of hospital pharmacy, clinical pharmacy over the last 25 years. And I am indebted to my teachers way back in 1990 to 1996 with one of the prestigious institutions in India. And we were groomed by our teachers. And once we did graduate, life has been very different. Life has been very different. Many of us are navigating various licensure examinations overseas. The last 25 years has been a learning experience. And even today, every day, each day is a learning experience for all of us. So, I'm fortunate to let you know that I've had the options or probably the opportunity to work with roughly about physicians from 14 different nationalities, physicians from the US, UK, South Africa, Australia, India, the Philippines, and so on. I've also had the opportunity to work with nursing professionals from different walks of life, laboratory technicians, fellow pharmacists, and pharmacy technicians. And all of this has been an overwhelming experience over the last 25 plus years. And I would want to tell you that the most critical or crucial experiences come from moments that are not anticipated by us. And I was not a person who was very inclined towards therapeutics. All of us, we get into a hospital environment. We have our prescriptions to fill in, refills, interactions with patients, counseling, patient counseling, monitoring drug therapy. It's an ongoing process for all of us when you are in the as a pharmacist in different sectors or walks of life. Uh, but there are moments which take you by surprise, moments in life which teach you a lot, which tell you that you need to learn more, or probably that your knowledge of therapeutics is very, very important. So let me just tell you of two incidences of here. So I have a 65-year-old woman who hasn't been to the hospital for any major illness all her life. Or maybe she had just visited the physician for a common cold or maybe a backache problem. And this person all of a sudden finds herself one day in this, I mean, severe respiratory distress. She's a mother of three children. She's taken to the hospital, and there are several investigations, blood tests, blood culture tests, such a lot of investigations that's ongoing. And the initial suspicion is that she may have acquired what's called as pneumonia. Uh, 3 days later, it turns out that it is not pneumonia. And the fourth day, she's put on a couple of scans, a couple of CT scans, and an MRI scan. And on the third or fourth day, the three children are called and told that this patient, is being diagnosed with an autoimmune disorder known as interstitial lung disease. So the woman over here, or the woman I'm speaking about, is my mother. So having been a hospital pharmacist into clinical pharmacy practice and so many other areas all these years, having come across so many patients with different disabilities or disorders all of my life, having dispensed so much medication, here I'm put in a scenario where my mother is my patient. I walked my mother's illness for almost 4 years. I was there with her. And at one point of time, I should say that all these terminology that we learn during our course of education, like what is called as diagnosis, prognosis, investigations, laboratory reports, all these seem to be very difficult terms to comprehend with. Sometimes they seem like as though they are bad words being spoken to us when it comes to our beloved ones. I've seen more from being a healthy person, being diagnosed with ILD at the age of 63, 64, it was specifically. And from them on, she was on high dose systemic steroids. I saw mom progress into a person who had developed what is called as drug induced hyperglycemia. A lot of side effects, a lot of drug interactions, so many medication, all immune suppressants. And at one stage, I had to talk to the doctors about alternatives. There were no alternatives. Mom had to live with it. We had to use all these medication. It was a tough walk. I lost mom about 4.5 years later. And that was a learning experience for me where I had to take therapeutics more seriously because walking with a person whom you love, seeing what they're going through, seeing the respiratory distress that she had to go through, going through the myocardial infarction that she suffered, all this was a learning experience in itself. Similarly, I would also add another point to here. We dispense a lot of medications. I've dispensed thousands of prescriptions on beta blockers, antiplatelet medication. For us, it's another prescription. Each prescription represents a patient, and we do our duty as pharmacists. So the second patient over here is my dad as well. So 3:30 a.m. in the morning one day, I find my dad holding his chest. They all these therapeutic interventions, modalities, what we've learned, all this come into play. You are excited, you are nervous, you do not know what to do. Uh, all what we've learned comes into play. And I had to rush dad to one of the neighboring hospitals to see if he requires fibrinolytic therapy. We were delayed in our what is called as admission to the hospital. Dad was on a scan and ECGs and all this done, and I was told that dad had suffered what is called as STEMI or ST segment elevated myocardial infarction. Dad had to undergo a PCI, or what we call this as the percutaneous coronary intervention. Dad had two stents placed inside and discharged the third day. Well, things did not end with that. The last 10 years, I've been with Dad. I've been his therapist. I've been his pharmacist all the last 10 years. I'll have to make sure that he takes his medication on time. He's on dual antiplatelet therapy that includes something like aspirin and ticagrelor. He has to take his beta blockers. He has to take his AC inhibitor lifelong. So life to us has been basically something where I would say therapeutics begins at home. This is what I've realized in my life. The therapeutics begins at home, and therapeutics is a very, very integral part of our life as pharmacists as well. So getting into all this, I would like to tell you that we are a team of members who have practiced overseas and some of us who continue to practice in various overseas jurisdictions. When we did go for overseas licensure examinations, be it in Canada, the US, in UK, Australia, or the GCC countries, we did realize, or while we interacted with fellow people, we had people from roughly about 100, different nationalities flocking in thousands of years to take up these international licensure examinations. And when we had a chance to interact with them, uh, we realized that their standards of education or their knowledge at that level was slightly what is called as on the higher side from all of us compatriots. So we got to interact with many of them. And one thing we got to realize is that the training process for licensure examinations, no matter which jurisdiction it belongs to, was integrated along with what is called as the course curriculum, meaning that let's take PharmD for example. While they are in their second PharmD, they began or they are trained for licensure examination. So by the time a PharmD approaches the fifth year or internship in the sixth year, the person is well aware of what is licensure examinations, what is the examination pattern, what areas they have to focus, and they are strengthened. They are strengthened with knowledge, which was not in our case because we had to graduate and then we have to look into ways how we navigate. So it was a long process. It was a long process. And the reason for associating with CliMed and bringing this initiative in India is to fill in this little loophole where we know that there are numerous institutions in India, staff members across institutions doing a wonderful job in getting training you as pharmacy professionals. But we would want this to be a complementary program which can probably give you those wings to face your physicians with a lot of confidence, to work with your patients with a lot of confidence, and again, explore career opportunities overseas as well. So that's all about Rx-Edu, and I will definitely talk about this as we go ahead. That said, we've got a panel of speakers, experts today, and I would like to introduce you to our first speaker. I guess she's online. Kirti, are you online with us?
Yes, yes, I am.
Hey, Dr. Kirti. Hi. Can you switch on your webcam as well?
Yes, of course. My hands are really cold.
I
It's taking
understand.
a
Oh,
while.
wonderful, wonderful, wonderful,
Hi,
wonderful,
sir.
wonderful. Hope you're wonderful. How are you?
I'm all right, thank you.
Wonderful. Thank you for joining us. I understand it's extremely cold, and
Yes.
Thank you for joining us in between your work break. I think it's your lunch break time, right?
It is, it is. I'll be
Okay.
happy
So
to
to
join.
Okay, wonderful, wonderful. So sometimes I need to look into a paper to read some of the credentials because some of our PharmD professionals, some of our pharmacy professionals have achieved so much over there that it's difficult for me to memorize everything and dictate. So, so
No
let me just
problem.
read out just an introduction to Dr. Kirti. Okay. So
Mhm.
we'd like to introduce our esteemed guest of today, Dr. Kirti Jayalakshmi. I would call her a fellow pharmacist and a cherished family friend residing in the UK. Okay, so we call her affectionately as Kirti.
Yeah.
Kirti holds a PharmD degree from one of the prestigious institutions in South India. And I guess she's the second batch of PharmD professionals to have graduated from India. I think it was 2015, if I'm not mistaken.
Yes.
Okay, so Kirti is someone I have personally witnessed, and I stand witness to see her evolving in her career. She was extremely focused. She started off her career initially in clinical research, but then slowly gathered what is called as something as what is called as an interest towards what is called as therapeutics. She wanted to move overseas, and she had a clear vision, a 3-year vision, where she wanted to move to the UK and be licensed as a pharmacist in the UK as well. So today, Dr. Kirti Jayalakshmi is a registered clinical pharmacist specializing in mental health at the Gloucestershire Hospital's NHS Foundation Trust in England. Now, in addition to all her responsibilities, she also contributes actively. She's also an instructor and preceptor for international pharmacy graduates. And she's also on our board as advisor to what is called as CliMed and EduRx. So thank you, Kirti. And on behalf of all the participants over here, we want to welcome you. And I think the time is all yours. Yeah, you can take over.
Thank you. I'm so thankful that you had called me for this event, and I'm so glad that finally you started it. I wish you had started it 10 years ago when I was struggling to like move abroad and to know the things how to deal with it. But anyway, better late than never. And I wish all the best to everybody. And do let me know if if I speak really fast because it's really cold where I'm sitting and I'm literally shivering. That's one
I
thing.
think you're fine. I think you're
And
fine. Yeah.
yeah, and if I'm not audible, then also please let me know. Uh, can everybody hear me?
Yeah, I think all are on mute, but yeah, we can hear you, Kirti. You could carry on.
Yes. Since all of the participants are, I think most of them are doing PharmD and some, and many might be doing B-Pharm. I really wanted you guys to know that pharmacotherapeutics is the core of the pharmacy profession if it is clinical pharmacy that you want to go. And it's it's really important that you know how to apply your knowledge, and without knowing pharmacotherapeutics, this is going to be really difficult first, because I feel like there is a big factor called as confidence that knowing pharmacotherapeutics will bring into. I mean, without this, I don't think any clinical pharmacist can last longer. At some point, somebody is going to know that, okay, this person is a graduate, is a registered pharmacist, but still doesn't have it. That takes it to become a good pharmacist. So the best thing to do would be to start early, maybe in your second year, to actually get into the subject, to know how to apply your knowledge rather than just mugging up the drugs, the contraindication side effects, how to relate it with the condition when you're being dealt with the patient, to go into the patient level and see how to manage the disease. That should be the core, I feel, because in real life scenarios, you won't be given a drug, you'll be given a patient with so many symptoms and so many conditions, and you're left to find how to manage all these symptoms. So without knowing all this is going to be a really it would really affect your career as a clinical pharmacist, because it's the live patients that we are dealing with, not case studies, not any medications, nothing. And to be fair, to have a training and that emphasis on the medications is really important. It's because we really need to know what to look for, where to look for, and what information has to be taken up from whichever notes. I have seen Jacob sir's note while I was preparing for exam. He really did help me with all the diabetes and all, because I don't think I had that in me to take an exam. It's really concise, it's really direct, and it's also thought provoking. Like once you read a question, there will be choices which looks like everything is right, but we really need to think about it. Like have to go into the disease, have to go into the drugs, and then make the choice to see which is the safest option for a patient. That is how international exams are. What can I say? That's how an international exams are being taken. When I attended, there were so many questions that I don't think came up ever in my life. One such example would be uh, about a transgender. So the question was, it was a transgender patient, and also that patient had acute kidney injury. So we had to think about the gender, which gender to see. Is it the one like, and that patient also was undergoing gender reassignment. So there were so many factors to consider: patient level, disease level, which formula to apply, which medication will be made. So when these critical thinking aspects will only come with right training and then right experience. And Jacob sir would be the best person in India who could guide.
Thank you for
Then
those
what?
kind words.
No, it's not just kind words. I'm saying from my experience, he was really, really helpful for me. I remember like 4 or 5 years ago, I wanted to do OSPAP, but I had no idea how to do it. I filled out the forms, I went to him, and then that's how he helped me understand a little bit more. And then he shared his notes for free with me. I don't think he does. I mean, anyone will do that because
No, no,
that's
let's not make that public now.
no, it was really helpful. What I say is he's really dedicated as a teacher. His vision is to make sure that the PharmDs who graduate from India are competent enough to work abroad. I'm not saying that pharmacotherapeutics is important if you want to work abroad, irrelevant of where you want to work, even if it's in India, if it's in UAE, UK, Canada, anywhere, wherever if you're facing a patient and that is your role, definitely you need to have a sound knowledge on pharmacotherapeutics, because that is really going to make a huge difference. If you see, I graduated in 2015, and it took me 5, 6 years to finally become a clinical pharmacist. And the huge reason for that gap is I was not confident as a clinical pharmacist. I didn't know what it had, I mean, what needs to become someone who could be trusted upon with human beings. I mean, it's not like we're playing with drugs and we're playing with uh, alive people. So we should be responsible enough for that. Am I missing out anything, sir? I think I really
Yeah,
need to
can you
look into
just
my.
take our can you take our learners through the licensing process for the UK? Yeah.
Yes, in UK, if it is an overseas candidate, they need to take a conversion course, which normally will be a PG diploma. I think it's 9 months, or an MSc. I did MSc, which is like 12 months. So it's one year conversion course, and then 1 year training where you have to do like where you'll be shadowing pharmacists, either in a community pharmacy, which is very different from India, or in a hospital, in a clinic, or in industry, but the preferred is community pharmacy and hospital. So that training, the tutor has to mean the pharmacist whom you shadow has to feel that you have become competent enough, and then you're ready to take the licensure exam. Then that gets checked off. After 2 years, you take the licensure exam. Then you have to take two paper. One is the clinical and the other one is calculation. And then yeah, you pass, and then you get your license. You get to work as the pharmacist, and you get a PIN number which will make you eligible to work. You can either split, you can work in hospital as well as community. It all depends upon, and then your life will be determined with that PIN. So you have to always make sure that whatever you do is safe for the patient. It's also safe for you. It is within the legal limits. And Yeah, all the rules have been checked off. At the
Okay,
end,
so
Could you shed some light on
yes,
the OSPAP program, that is the Overseas
yeah,
Pharmacist
and
Assistant Program?
Dr. Kirti, I also
yes,
have one added question to this. I'm Dr. Ajit. So I have one
hi,
added question
Ajay.
to this.
Yes,
Just tell our learner about the toughness of the exam and the cost of the exam, because these two things are very important.
yeah. First, I'll say the duration. It will take 2 to 3 years, including the preparation for course, the admission process and all. That will, in India itself, it will take about 6 months to get an application and all. Then the course is really tough. It was tough for me. It was not tough for my juniors. Because there was no gap. I mean, after they passed, when they did OSPAP, there was no much gap. So gap also determines how difficult the exam is going to be because you lose in touch. The I felt OSPAP really tough because it took me so much time to understand, to work out how to apply therapeutics knowledge, and then the exam. The pass percentage was last time was 80 percentage. It is a really tough exam because you are competing with pharmacists who are trained in UK, and pharmacists pharmacy is a profession that is chosen by highly academically inclined students in UK. So it is, so our competition is so high. It's not just the number, it's with the brains that we compete with. So the exams are designed in such a way that when you get your registration number, the council is telling to the public that yes, we feel that this person is safe to work for the public. So on the toughness level, I can't say. I feel like if I'd prepared like this in India for any exams, I would have cracked maybe AIMS or something like that because it's so tough. It's very, very, very tough. I It
You,
needs
I
so
think one
much
of our
preparation.
viewers,
I can't
yeah,
say.
could you shed
No.
some
It's
light on the
so
cost as
tough.
well?
Oh, cost was, mine was around 25 lakh because, and also we get paid in training here. We get paid about, roughly about 1.5 to 2 lakhs per month during our training year. And for the course, if PG diploma, I think it was 18 lakhs. For MSc, it was about 20 lakhs. I'm talking about 2021 batch. Right now, I think slightly it increased, but then it will take about 25 lakhs.
Okay, so my question here is again adding to the same question. Is it mandatory to
Yes,
do the conversion course?
it is mandatory.
Okay,
That
guys.
is,
So yeah,
yes.
and I have one question here. Are B Farm also eligible for this? B Farm, Bachelor of Pharmacy people?
Bef Before, I think
I think
B Farm
yes.
is eligible. I
Yeah.
think yes, because they need to get their certificate converted first, and from India or anywhere they apply. First, the British Council has to approve that okay, this person can undertake overseas pharmacist assessment program, and then I think B Farm would have to take an MSc. But either way, they'll give the council will inform the applicant whether they're eligible or not. And
Okay.
even for initial application charges is less than 1 lakh. And also the most important thing along with therapeutics is knowledge in English language. That is going to help a lot. Even I think IELTS is also there. That exam has to be taken. So make sure that
What was the band
you cover
score
that side
requirement
also.
on the IELTS?
When I did it was 7 in all
Okay.
band.
Okay. So I believe this is similar. Like the students have to first go for the document check, as it usually happens in Australia and Canada. So first document check,
Yes,
and then they have to go for, once they are eligible, they can go for the conversion course or MS.
yes, yes,
Then they can go for
yeah,
the licensure. Right?
yes, yes.
Great.
Uh,
So overall,
Document
for
check.
a fresh PharmD, I'm sorry for that.
Sorry.
For a fresh PharmD graduate who does not intend to take a break, so how long do you think is going to be the process to navigate licensure soon after PharmD?
Um, 3 years.
3 years.
Three
Okay,
year,
okay,
3 years, because
3 years,
1 year
3 years.
we definitely have to be in India to make sure that we are registered in India. Then we need to apply that application to the GPHC is also a long-winded process. You have to make sure that all your documents are ready. You need to make sure that the IELTS is done. Then you need to get a NARIC statement. I think now the NARIC is different. That's an organization who will assess your degree in India and will say that either, yeah, this is level 7 or level 6. That certificate is required. And after all these, I think, recommendations, I can take a session on application of it later,
But
So
because that
definitely,
definitely
itself
we
is
would
definitely.
invite you. We will invite you definitely. So I think guys,
yes.
there are a lot of questions, but I'll take one very important question. Someone is asking, after being registered there as a registered pharmacy, can we go to the industries? Are we eligible to work in the industry?
Yes, industry is eligible, but what, as per my understanding, than industry, most of the people will prefer to go to the hospital or community pharmacy.
Yes.
Kirti, I'm not going to
Okay.
ask you this question directly. I'm sorry for this question. I'm not going to ask you your salary. I know you
Ye-
make a lot of money, but
Yeah,
let me
there
put
is
yes.
it this
one.
way.
See, I think I was also supposed to ask her, like, she can talk about the bar, right? How much
Okay,
your
I can
students will
say,
get per hour or per month or per whatever is the paycheck there for the pharmacists.
so, see, so if anyone can check the band salaries in UK, so the during training, as a, I mean, before registration, pre-registration, yeah, the training would be, they will pay you band 5 salary, which
Okay.
uh, if I have to convert the pounds into, that will be around roughly 25 lakhs per year. That would be, and when you become, I mean, after, this is before taking the exam, during the training year. If you see band 5
You are
NHS
talking
salary,
in INR, 25 lakhs INR.
yes, that is during training, before the license, before you become a registered pharmacist. Once you become a registered pharmacist, the NHS band you'll start will be band 6. That is, I think, 35,000 pounds, which would be around 35 lakhs per year.
35 lakhs, yes.
That is if you work in a hospital, but if you work in community, that is going to be way too high, because community is really stressful. That will be around 45 to 50 lakhs per year starting salary.
Guys, hear it. Guys, hear it carefully.
Yeah.
Be on your ears. Be on your ears. Okay.
Yes. Make sure that
So your
you study well.
yeah,
Especially make sure
25
that you
your
study the
absolutely
pharmacotherapeutics.
your 25 lakhs or 30 lakhs investment is nothing. You can get it in 1 year. Okay. Okay. So
Yes.
I think the question is, can BPharm people apply immediately, or do we have to do PharmD? Not at all. If you are a BPharm, you can directly apply as PharmDs can do. Okay. Absolutely. Okay. So, sir, we can, I think, go ahead and we can take these questions further later if we have time. Otherwise, it's
Yes.
9:30. Thank you very much.
Yes.
Sir, over to you.
Yeah, Kirti, thank you so much. Is there anything else you
No
want to
problem.
press on?
Sir, I think one more very important
Um,
question I got from Faz. Do Scotland have the same pattern?
It is Scotland, Wales. Yeah, Scotland, Wales, but slightly there is slight difference between band, because I think their tax is different from the
Okay.
England. Yes, it is about the payment that is different, but the course, the training, and all is same. But slightly it will be variation, slight variation, because the prescriptions are different in Scotland and Wales. Slightly, not much.
Guys, if B farms are allowed, M farms are definitely allowed. Okay.
Yes,
Yes, absolutely.
it's so cold. I'm feeling really
Okay,
cold.
no problem, Kirti. Thank you very much. Sir, over to you.
No
Yeah.
problem. I can hang on. Yeah.
Kirti, thank you so much. We will
No
invite you
Amma,
problem.
again,
Achu,
probably the next few
Achu,
couple of weeks.
Daddy.
Manju, can you mute your audio?
Oh,
Manju, can you
sorry.
mute your audio, please? Yeah, okay. Kirti, thank you so much. We'd be happy to have you on another session as well,
Yes.
when you find time.
Guys, whoever
And
have
can
the
you unmute
questions, we will
yourself,
have
Kirti?
another session of it. Yes.
Yeah, and thank you so much. You could, yeah, join us anytime. You're on mute, Kirti.
My hands are
Yeah.
frozen. I'm so sorry.
No, you
Oh,
Yes.
sorry
please,
for that.
please
Sorry
go
for
ahead.
that.
Sorry
Yeah.
for that. Thank you very
No,
much.
that's
We
okay.
can
I'm,
understand your condition right
yeah,
now. Thank
I'm,
you very much for joining
I'm,
us.
yes, I'm so happy that I could join. And also, I'm so sorry. It's been like so short duration. I
That's okay.
really need to
We'll call
go
you. We'll
back
call
at
you again
some
for the
point.
full-fledged
Yes.
1 hour session whenever you are free. Very soon.
Perfect.
Appreciate your
Perfect.
time. Appreciate your time.
Good
Thank you.
luck
Yeah.
to all of you. I'm
Thank you.
so good that you both have started doing this, and I'm so glad at least now it has started. I wish all the best to all the students who have joined.
Thank you very much. Thank you
Thank
very
you
much.
so much.
Thank
Thank you.
you.
Thank
Thank
you.
you.
Bye-bye.
Bye.
Bye-bye.
Yeah, Doc, let me see if Sheba is there, but just
Yeah,
take
she's
a
here.
few
She's
questions
here.
from the
I,
students.
I
We'll
I
go ahead.
made her the co-host, so Siva can open her mic and videos. That's okay. We have her here.
Sheba, hi. Are you online? Plus?
Hi, Jacob. Hi, everyone.
Hello. Wonderful, wonderful.
Hi.
Good to see my wonderful
Um,
friend after a long time.
Yes,
yeah, it's such a
definitely.
privilege to see you all, especially Jacob, after so many years, probably 20 plus years, right?
Wonderful,
Hi,
wonderful,
everyone.
wonderful.
It's a great opportunity to be with you all and to share the journey to be a pharmacist. I'm from Canada. My name is Sheba. And Jacob asked me to say a few words on how to get licensed here and what is the scope of practice in this land. I know when you are studying all this, a lot of people are so confused as to what you have to become. I would say that it is one of the broadest avenues you have got as a pharmacist. When you study your pharmacy, you can choose your career. You could either become a business person, you could either become a clinical pharmacist, you could become like Jacob and Dr. Ajit, basically training a lot of other people. You could be a hospital pharmacy. So your
Absolutely.
scope of practice is very, very broad. And that's awesome. And you guys are pretty lucky too that you have platform to learn. I started my journey probably in the 2000s, and that's when I met Jacob when he was writing his American exam, and he was the person that motivated me to go to North America. I was in Dubai at that point, and without his support, I don't think I would have known how to study structurally in India.
That's a humbling
The way
experience
we
for
learn
me.
is,
Thank you.
yeah, I think I'm glad that you took the route to teach so many of them, right? And it's not easy to choose that path, right? We all chose to come to North America, but you stood there and you opened up a training center. It's not easy. So I'm totally understanding that now you guys have avenues where you can upgrade your learning, right? So when we go to college, we learn all sorts of subjects. We learn chemistry, 4 or 5 chemistries, which practically we don't use it in our practical world. And pharmacotherapeutics is one of the most key point to be a clinical pharmacist. The earlier you learn how to study that and master that, that will give you the benefit into your licensure exams in different parts of the world. Every country has its licensing exam. Therefore, your licensing exam is another cost added to your education. And so, however shorter you can make it, the much better. Anyone who comes to Canada would be spending around 3 to 4 years to get licensed as a pharmacist. And now the reason is because you have to first prove your equivalency. So if you're a bachelor's or a PharmD, you have to show that your curriculum is equal to Canada's equivalency. So that's the first exam. And then the new rule from past 4 years, we've got the CCP education, which is known as the Continuous Competence Pharmacy Practice, which is a bridging program done in different provinces of Canada for 1 year. The cost of it is $16,000. Some are provided with grant, but the grant is probably just barely for 20 students, whereas the applications are probably more than 1,000. So that's 1 year worth of, going to the college and upgrading yourself. And then you've got your MCQ and OSCE examinations. MCQ means multiple choice questions, which is usually scenario based. So it's going to be more kind of a real life world situation where you're given a case study and you will have to see which is the appropriate therapy for that case study. The third one is OSCE, objective structure competent exam, which is mainly like a real scenario where you have patients acting with questions and you have to provide the appropriate therapeutic answer. After that, you have 6 months of internship and then you get your license. So it's a whole lot of process. But I would say if we did it, I'm from Vinayaka Missions College of Pharmacy, Dr. MGR University. If I did it, everybody can do it. And that's what I would say for everybody. But it's important to have a passion. Follow your passion. Follow what you're interested in. If you're interested in clinical pharmacists, please make sure you start way ahead in doing case studies and working on your therapeutic knowledge, is what I have to tell you.
Thank you so much, Shiva. That was so wonderful. Can you just shed some light on the certified diabetes educator that you are, and also on the additional prescribing authorization in Canada?
So certified diabetes educators are, once you are a licensed pharmacist, and if you have 800 to 1,000 hours of shadowed experience in taking diabetes patients or educating diabetes population under diabetes educator or under any leadership, they'll be giving you a letter to write this exam, and you're covering majorly more than 45, 50 areas of diabetes specific topics. And then you have a competency exam. The exam costs around $500, and you will give the exam. And if you pass the exam, then you get the credential as certified diabetes educator. And what happens is that then you work collaboratively within a doctor's setting plus the community. You get referrals from doctors to educate patients with diabetes, start patients on insulin, see if the therapies are appropriate, make changes to it. But making changes is only possible if you have prescribing authority. And now prescribing authority is only applicable in Alberta. I think most other provinces are working towards it. Ontario has something known as minor ailments prescribing, where you can prescribe for 20 or 25 plus minor ailments. Alberta has not restricted that for a pharmacist. You are authorized to prescribe what deems appropriate for your patients. So you get that. You probably work towards it. There are still lots of pharmacists who haven't got that. After 1 year of practice as a pharmacist, you could apply to the College of Pharmacy for your credential to get prescribing authority. You have to prove 3 cases where you have done assessment or made a doctor recommendation and they have approved it, and they'll go through your cases. You have to show your proper documentation and your follow up, and then based on that, they will give you this authorization.
Wonderful. So, is this additional prescribing authorization, is it a step forward where you ease the burden on the physicians concerned, and where some
That's
minor
correct.
ailments can be taken care by the pharmacist as well?
Yeah, so technically speaking, they want to ease the burden on doctors, because most of the doctors are like, it's very hard to get a family physician here. So they want the pharmacist to take the burden of, let's say somebody is with UTI, cold sores, or empirical therapy for sinusitis or chronic bronchitis. You're able to write that up, but you're only possible if you can do a proper assessment and you have a prescribing authority.
Wonderful. Okay. Anything else that you want to add on, Dr. Ajit? Do you have any questions?
So there are some questions as well, and people are asking many times they have asked. So can you tell us the recommended books, please? So guys, just wait for some time. We have come up with a wonderful platform for you where you will get all the notes, where you will get all the material, where you will get all the question banks for OSCE, for evaluation exam, for MCQs, everything. Okay. So that's what is the launch of CliMed Overseas with Rx-Edu. Okay. So just wait. We have everything for you in one platform. You don't have to wait for anything. You don't have to, you will get everything with us here. And there are some questions, I think, for Canada. Is bridging compulsory to be a registered pharmacist in Canada? Are any other short-term course we can pursue during the studying for licensing exams? Siba, if you can take this question, please.
So the three places that require bridging is Ontario, BC, British Columbia, and Alberta. All the other provinces, probably you don't have to do that. But again, the scenario is if you don't pass the exam in the first attempt, you still have to do the bridging program. So it's about getting equipped for it.
Yes. So if you are not clearing the exam in first attempt, then you have to go for bridging. Otherwise, no need. I have seen many people who have cracked all three levels in one exam, first attempt. So they don't have to go for bridging at all.
Wonderful.
We are
Okay.
best training institutes.
And
Which
what's the
are best training
frequency of
we provide all the
examinations?
provide all the trainings, and we are coming up with, because we are known for it. We have done a lot of trainings before also for licensure exams, and now we are launching all again to all of you. And I think there are some more questions if I can take. Yes, and one more important thing, guys, for Canada, for PEBC, you can give your exam from India right now. After the COVID, that is the best part has happened, that you can write your evaluation exam and the MCQs from India itself. Am I right, Siba, if you can just confirm?
I'm not sure about that though. I'm not
No,
sure about,
it is then, I think it is there. I mean, you can write
yeah.
your first two exams from India. Yes. What is the
I
procedure?
know that there is a center in UK. I gave in UK PVC.
No, many of our students have given from India, that is for sure. And it is right now, they have not fetched it back right now. It is
Dr.
there.
Ajit, if I'm not mistaken, I think there was a proposal for PBC1, that was the equivalency examination, but
No,
it's
no.
not yet for PBC2. To my
Yes.
understanding, it was PBC1, and earlier they had
Evaluation exam.
centers.
That is
Yeah,
evaluation
they
exam.
had centers. Yeah, it was like the FPGs in the US. Earlier, they had examination centers in the UK and Singapore as well for PBC1. And now there's a proposal to bring it to India as well, but certainly not the PBC Part 2, which is
Okay,
your
so
qualifying
PVC part
examination.
one, that is evaluation exam, can be given, yes, can be attempted in India. I'm very sure because some of the students have written in Trivandrum and Bangalore last year. So maybe, yeah, PVC one evaluation exam they can write in India. Yeah. But for sure, US, FPG, NEPLEX, even, TOEFL, you cannot write in India. If you're going for pharmacy licensing exam, you have to go there
Yeah,
and write.
TOEFL again is mandatory that you have taken the US as well. Yeah, that's right.
Yes, yes. Okay, so any other
Shiva,
questions which you
anything
can take?
else you want to shed light on for the learners? There are a lot of youngsters over here on the forum, a lot of
Exam name
ambitious
is
learners.
PEBC, guys. Exam name is PEBC. So first level is evaluation exam, second level is MCQ, and third level is OSCE. Okay. So exam name is PEBC, Pharmacy Evaluation. I think Pharmacy Evaluation Board of, what is that, sir? I'm not sure
Pharmacy
about
Examining Board of Canada. It's Pharmacy Examining
Pharmacy
Board of
Examining
Canada.
Board of Canada. Yes,
The
PEBC.
first exam is the equivalency, and PBC2 is the qualifying examination, along with OSCE
Yes.
as well.
Yes. Can a PharmD graduate who is planning to go to USA have any option for 1 year course, just some fellowship with which we can work in healthcare? That only Jacob sir can answer.
I don't want to take the question at all. It's totally irrelevant. I
No,
would say that
that is some.
today I think most students use the platform of a student visa to move overseas, be it Canada or the US. Most students want to get into the country. They use either the PG diploma programs or the MS programs. And
Yes,
even most of my students, they've got into the US on an MS program, and finally they've ended up getting their licensure and practicing as pharmacists. Because I'm
yes.
sure that the salaries for pharmacists in the US or Canada are far higher than those in the industry as well. So,
Are we? Yeah. Are we
utilizing
eligible to
your
give caps
visa,
from
student
India?
visa, is a way to get into the country, way to
Absolutely.
facilitate your entry into the country.
Are we eligible to give caps from India? Definitely you are. Okay, so we are not talking about caps right now. That is for Australia, but you are eligible to give from India. I have one question to Siva. I think she can answer well to the students. How many attempts we get in the first PBC, second PBC, and what's the duration for preparations in that?
All of these exams are 3 attempts. And after 3 attempts, again, as I said, there is a waiver for doing certain courses and you can do a fourth attempt. But then after that, you'll have to go back to school.
Yeah. So there is no age limit at all, I believe. Is there any age
Any,
limit?
no age limit.
Okay, no age limit. Yes.
So any specific areas you want our learners to focus on, those who are interested probably in a career overseas, what
Yeah,
would be your recommendations?
I got the same question all again. What is the cost of for PEBC exam? Can you please?
So I think I did it way back, but I think it will cost around $3,000. And now if you don't, $3,000 to $4,000. And then if you don't pass them in the first attempt, you will do the bridging program, which cost around $16,000 to $20,000.
Yes, yes, yes.
And then you will write all over again, spending another $4,000.
Yes, because one of my very close friends, she has done the bridging program just now. She has just finished that, and that was costing around $18,000 Canadian dollars.
Expensive, expensive.
That costs a lot.
Yeah.
I just wanted to, touch base on one question, Shiba, and that was, you see, the PharmD students have the opportunity to study therapeutics, right? They study therapeutics right from the second year, ongoing till the fifth year, and then they have an internship as well. So I think most of the PharmD students find the second examination, that is the qualifying examinations, quite easier. What would be your suggestions for those of the B-Pharm students who have aspirations to move there because they are not exposed to too much of therapeutics?
I kind of feel that it really doesn't matter. It is about your passion and you follow the right steps. The more you're equipped, like I've seen B-Farm students are much better than the PharmD students. And that's
It's wonderful.
technically because how you are capable or how passionate you are, right, in doing the clinical aspect. So I think the key point is case studies. And the most important thing is your assessment. Like if your assessment, as Kirti said, whether it's a female or a male, what is the age of the patient that you're looking into? Is there any underlying condition that is contraindicated in the ongoing therapy? Is there allergies? What is the current medication? What do you want to give? See, clinical pharmacist is, I think it's a fine line. Most pharmacists want to be doctors. They're all doctors aspirants who ended up as pharmacists. So you kind of want to take the job of a doctor, right? But I think you need to understand that doctors are diagnosis experts and pharmacists are medication experts. The moment you understand where you are expert, you will learn what you should and you will apply that into practice. When I was working in Dubai, the doctors would just call, hey, I have a patient, my patient is pregnant, 7 months, UTI, none of the medications work, allergic to cephalosporin, and her EGFR is 45 miles per minute. You have to be quick in navigating through your resources and give the answers right away to the doctor after looking. In Canada, you have access to Netcare. Netcare is where all of the patients, every record is there, their underlying medical condition, their recent lab works, where they took the current medication from. And the other problem that probably we face is in India, we'll go to one pharmacy, then tomorrow we'll go to different pharmacy. In Canada, you're going to stick with one pharmacy. You will have a prescription, it will have refills, you will stay with that pharmacy, you'll have a continuous relationship with your pharmacist. Unlike in India, you're not used to see the same face again. You'll take Ramipur 5 mg from X pharmacy, and then tomorrow you'll take atorvastatin from a Y pharmacy. So basically, you have no connectivity in giving a clinical care. But that's the difference, and that's a challenge you will face when you come to countries like this. You do not understand what's going on because there is a continuity of care. You need to know what the medications these patients are on, what their medical conditions are, what is their best medical history, what can be done forward to give them a best clinical care. So I think the earlier you learn, and that's why these platforms are beneficial for you at an early stage, because you know exactly what to do when you're facing those exams.
You give our students also learners idea of how long would it take to prepare for these examinations? Just a brief idea.
I think if you are solely dedicating, 6 months should be good enough. But then that's only if you're continuously studying 8 hours per day. But if you're working, if you have family issues, financial issues, everything adds on into this and it will prolong. So that's why I said the earlier you are on an education platform, you are, equipped to face these challenges, the best it will be. It will shorten the duration.
Wonderful. Thank you, Sheba. It's been a lot of insights from you as well. And thank you for the early morning time. I know it's about 6:30 or 6 a.m. in the morning. You're getting
Yeah.
to work as well.
Yeah. Thank you, Jacob.
Yes, absolutely.
Thank
Thank you
you.
very much. And I can see there are some more questions not relevant to this webinar, but guys, somebody is asking MSc in health informatics in USA and all. Sure, I'm here. I promise you, I'll come up with such webinars very, very soon. In February, I'm coming up with a lot of career opportunities webinar in USA and higher education webinars. So you don't worry, we'll come up with all of these. Okay, don't worry. Today we are focusing on pharmacy licensing exams, therapeutics, and all. Right, guys? Okay. Any other questions? Any other jobs than clinical pharmacist, for example, pharmacovigilance? Does that course requires exam? No. Industrial, I think industrial jobs, if you're going to the industry in Canada, you don't need to crack the PEBC, if I'm not wrong. Siva, can you please confirm?
That's correct. That's correct. Except for
And
being
what
a
about the
pharmacist registered pharmacist.
English language requirements, Sheba? Could you shed some light on that?
Yeah, you can do the IELTS and you can do that prior. PEBC requires it anyways.
Okay,
Is
IELTS
it
can be
is it
done in
is it
India
you?
as well, right?
Yeah. But Siva, can you please tell me, is it required before the exam, or maybe I heard that you can write it before, just before going to the Canada, just before moving to the Canada, anytime?
Yeah, anyways, you will have to write that if you're going to
Yeah.
come here. So,
Yes.
yeah.
Thank you very much. Thank you very much for this wonderful insights and answering all the questions. Guys, do you have any other questions? Which is more recommended, MPharm versus PharmD? We'll tell you in the next class. Okay.
Frankly speaking,
So,
it really doesn't matter.
Yeah, it doesn't matter. It really doesn't matter. Okay,
Yeah.
guys. So one very important issue before I forget it, for Canada, Australia, or any Gulf country, or even for the England, as he was talking about, B farms are equally having the right to become the pharmacist. But for USA, you need 6 years degree, not the 4 years. Okay. To go there, you need 6 years degree, either B Farm and M Farm continuously, or maybe the Farm D. Okay. Direct after B Farm, you cannot apply for the US FPG and NEPLEX. Okay. So that is the information from my side, and we'll go ahead now to Jacob sir, so he can go ahead with the next speaker. Thank you very much, Siva, for joining in this early morning. Thank you very much.
Thank
Sheba,
you.
wonderful,
All the
wonderful
best
to
to you
see you
all.
here.
Thank you.
We would definitely want your guidance for these wonderful learners in India and elsewhere in regions of Africa, Middle East as well. I'm so happy for you, my wonderful friend, and I'm sure that your insights in the future should be wonderful and guiding to many,
Absolutely.
many, many people who are aspiring as well. Thank you so much for your time, Sheba.
Thank you very
Thank
much.
you. Thank you, everyone, and all the best for all of you.
And
Thank you
guys,
so
don't
much.
worry, we'll be coming up with the series of webinars for every country, either that is Australia, that is Gulf, that is Oman, that is Dubai, or wherever. We'll be coming up with all the webinars under Rx-Edu umbrella. Okay. Is Neplex harder than PVC? Definitely, yes. If I say as I heard of the people, yes. Neplex is quite
No,
hard.
Doc. Doc, can I interrupt you, Dr. Ajit?
Yes, sir, please go ahead, sir.
Yeah. It's my opinion that the Canadian examinations are one of the toughest examinations the world over. If you are a person who can crack TBC 1 and 2, I think you can crack any exam across the globe.
Okay,
The
that's
NAPLEX is considered very, very, very easier in comparison to what is called as PBC 2 specifically. So most students, what they do is they navigate to Canada, but once they find the Canadian exam is very difficult, most of them move to the US to take examinations in the United States as well. So I would like to tell our learners today that Canada is a wonderful place to settle down, but the examinations are one of the most difficult to navigate. So the earlier you prepare, I think it's easy to navigate. Now, I just want to give you an example of two students just before we go to the next speaker. So during one of my training programs in India, in one of the institutions, I do not want to take names, I had two students over here, both men. And one of the students was a student who always used to sit in the front bench. And the guy was very, very, very attentive in the classroom sessions and all that. The guy was very fluent in English, very attentive. And then I had a guy who was the back bench, probably in the sixth or seventh row. And whenever I would call on the student at the row behind, he was very negligent. He would not be willing to come forward. He was not interactive. And I lost touch with them for probably over 3 or 4 years. And then I happened to get in touch with them. And learned that these guys have moved on to Canada on student visas. So, to my surprise, the guy who was on the front bench over here was still struggling with his licensing exams. And the guy at the back bench, I asked him, "What are you doing in Canada?" And he said, "Sir, I've cleared PBC 1, PBC 2, my OSCE exams in the first attempt." So it was a tremendous effort that was put in by him. And I was so happy that he got through all his licensing exams in the first attempt. And he works for one of the reputed chain stores in Canada. So it's a lot of hard work, a lot of hard work. There's nothing to say that nothing is impossible, as what Shiba and Kirti have told us as well. And the examinations are getting a bit difficult, but again, we are here to help you as well with that as well. Yeah.
Yes. Okay, so
So
I'll
yeah,
just
before we
answer
go
some
into the
general.
academic program, yes, yes,
Sir,
please.
sorry to interrupt you. I'll just answer some general questions. So becoming pharmacist in USA is easier than Canada? Yes, sir says yes. Can you suggest preparations for exam? We have all the solutions for you. Please wait for some time. PharmD PB are eligible for USA. Okay, age eligibility. There is no age for USA, Canada, Australia, anywhere. I never heard of the age hindrance for the pharmacy licensing exams anywhere. Okay. Okay, so GPAT versus PVC, which one is harder? That I cannot answer right now because I did not give GPAT. I mean, neither GPAT nor PVC. I'm so sorry. Okay. So I have B Farm after 1 year work experience in the MSc in USA. Am I able for NEPLEX? I think yes, you are. Okay. And sir, is there any scope for pursuing degree like MD after from the bullshit idea? I'll talk about this later. Okay. And how many times one can give Neplex or PVC? PVC, as he told, 3 times. Neplex only, I think 1 or 2 times, not 3 times, if I'm not wrong.
Couple
Okay.
of items on the Netflix, yeah, it's a couple of items, and then you
Yes.
take a break for a year as well, yeah.
Yeah, exactly. PBCDM jobs will talk in the next classes. So now over to sir. And sir, I think, yeah, we have a little time. So over to sir and we'll take all the questions later. Yeah.
So let me see if Manju's there. Manju has a procedure at the hospital today, but she agreed to join us. So if Manju's there, I'll get her online as well. So any other questions? We could take some questions until we get Manju online talk, yeah?
Yeah. Sure, guys. So, okay, I'll take some general questions. It will be fun to have. Guys, so first of all, let me tell you, sir, why don't you show the platform by the time?
Yeah, definitely. Once I get to the platform, I didn't want probably any interruption for a few minutes. So I thought if Manju could just join us, then we could probably get to the platform as well.
Is Canadian registered pharmacist eligible to work in USA? I'm literally not sure, but if sir can give some answers regarding that.
So could you repeat the question? I'm sorry for that.
Is Canadian registered pharmacist eligible to work in USA?
No, they'll have to go through the licensing process once again. Probably there is an exemption from the FPGC exams, but NAPLEX exams are mandatory.
Yes.
It's
Sir,
vice
could you,
versa as well. There are people in the US who have already completed the NAPLEX, and if you want to work in Canada, maybe you would be exempted from PBC 1, but PBC 2 and OSCE becomes mandatory.
could you please recap
These are
once
two
again?
different jurisdictions.
Yes. I browsed the site website, but not accepting payments. I browsed the site platform, but it's not accepting the payment. No, payments will be, accepted by 28th of the January. 20 January, 28th of the January, 20 January. So right now, today we are showing the platform, we are showing the website, and our website is completely ready. But the payment things will be, and the site will be opened for everyone from the 28th. Okay. No, sir, we have to give any exams for working in the industry in other countries? Not at all, yes, one. No. If you are working in the
You know,
industry,
absolutely no. But what I want to tell all the learners is that if you are interested in the industry, it's wonderful. It's wonderful to get in the industry, but the salaries in the industry are far less than what the pharmacists earn. And most of us, most of our seniors or juniors, most of them prefer to be working as pharmacists where the pay scales are high. There's a lot of flexibility in terms of your options to work and all that. So yeah, if you're interested in the industry, certainly there is no need for any examination. But again, you'll have to be ready for a long haul in the industry, different work schedules and all that. So yeah, that's about it. Manju, are you there with us? Can you unmute yourself? You'll have to unmute, Manju. Can you hear me? Let's check on your phone if you could unmute Manju. I think she's going to log in again.
No worries, sir. It's okay. It's fine. So if not, we will. So can you just share the email? I mean, our website here in the group chat.
Yeah, definitely. I'm doing that right away.
Meeting will be over in next 20 minutes. Don't worry. Don't worry. Don't worry. And if you want to leave, it's okay. For the feedback, you can join after 15 minutes. I don't force you. Okay. That's okay. If only joined for the certificate, then you can join again after 15 minutes. That's not a problem, guys. Sir, in new, your pharmacist can prescribe the medications in India right now? No, not at all. And outside also, if I'm not wrong, if Siva is here or maybe Sir can confirm, in USA also, no, in Australia recently they have uh, you know got some rules and regulations where pharmacists are eligible. They made the pharmacist eligible to write or prescribe only the emergency medications in elderly population, not all at all. Okay. Same thing in Canada. Only in some provinces they are allowed to write only emergency medications, like for in India, cold and cough. Not at all. Otherwise, they are not eligible to write the medications. Okay. Yes, Gangavati will be coming up with all the educations very soon. Yeah, in New York, pharmacist can prescribe medicine. Not at all. Which country will be the best to work as a clinical pharmacist, and which country pay high? Okay, in the payments, USA pays very high. I mean, around $50 to $60 per hour. Canada pays $40 to $60 per hour. Australia pays $40 to $60 per hour. So these are the three countries in my knowledge which pays the highest salaries to the pharmacist per hour, not the per month or per week, per hour. To work as a pharmacy assistant in Canada, do I have to write the exam? Definitely. Yes. Yes, absolutely.
Australia's got a couple of exams. The first is called as the CAPS exam, which is the Knowledge Assessment of Pharmaceutical Sciences.
In
And
Australia.
these examination centers are in Delhi and in Bangalore. And
Yes.
examinations are organized twice a year. And you could complete the CAPS, which is an equivalency exam. But to take up the second exam, which is CAOP, it's called the Competency Assessment for Overseas Pharmacists. Probably you'll
Yes.
have to undertake an internship and do the exams in Australia. And don't
So
forget
can
the
you
CAPS
please
exam is common for both Australia and New Zealand.
Okay, sir, can you please share the website link once more, because I think not getting the proper internet here to get that.
On top one.
Yes, guys. Sir, I think if Manju is not ready right now, can we go ahead with
No,
the?
she's just texted me. She's stuck up in the snow over there. So
Okay.
she's,
Yeah, yeah.
yeah, I think we should be able to reach out anytime.
Okay, 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 okay. Perfectly fine then. It's okay. Okay, I'll get the YouTube uh comments, some of the YouTube comments. So, sir, please
Yeah, I'll
suggest.
just share the link. I've shared the link.
Okay, sir. So, can we please know the exact stepwise approach for the pharmacist in Canada? I think Siva has told the stepwise approach. First, the documents evaluation, then the PBC step one, that is evaluatory or equivalence exam. Then the second one, the MCQ we call it usually, and the third one is OSCE. Okay, and every
Let
uh,
me just add on this.
yes, sir.
So I just want to know, want my learners to understand that navigating the exams overseas, specifically, I'll talk about the North American continent.
Yes,
There are two examinations. If you are a graduate who's educated outside the US and Canada, then their first step is to take up your equivalency examination. Now, equivalency examination focuses on almost all areas of pharmacy, be it your microbiology, your biochemistry, your medicinal chemistry, your pharmacology, pathophysiology, whatnot. Everything is included in the equivalency examination.
yes,
Whereas the second exam, which is the qualifying examination, it focuses more on areas of clinical expertise and therapeutics. So an equivalency exam is mandatory if you are educated outside these jurisdictions. And again, you'll have to navigate through a second process called as the qualifying examinations as well.
yes,
So
absolutely.
this is about it. So in the US, it's called the FPGC, which is the equivalency exam, and NAPLIX represents what is called as the qualifying examinations. And in Canada, PEBC1 refers to the equivalency examination, whereas PEBC2 and OSCE represents what is called as the qualifying examinations. And coming down to Australia, it's the CAPS, which is the equivalency, and CAOP, which is your qualifying examination. Actually,
Yes.
we'll talk about
Step,
this later. We'll talk
yeah.
about it as we go by.
Stepwise approach for CP in Dubai. Any exam needed? Yes, there is exam. DHA, Dubai, Health Authority. That we'll talk about in the next webinar for sure. And because right now we have a little lesser time, so don't worry. We have a series of webinars for all of you. As you said, 6 years degree for USA, either BPharm plus MPharm or PharmD. But I want to know if the PharmD PB are eligible for that. Absolutely, Janvi, you are eligible for USA exam. PharmD PBs are there. My friends are working in the US after family postbaccalaureate. Sir, I want to study my PG. I'll talk about the education, higher education in USA next time in the next webinar, guys. Don't worry. What is the best time for applying to NEPLEX? No, there is no best time. They have the dates. They have the fixed dates. There is no such best time or bad times to apply. I believe they have the specific dates for that. There is only once in a year right now. Okay. So you told that are taking license USA, you must do 6 years BPharm degree, but in India we study 4 years duration BPharm. Then go for either MPharm, pharmacy practice, go for PharmD post baccalaureate, continuation. Then you can achieve that goal. Okay. Yeah, BPharm and MPharm, pharmacy practice or pharmacology must be without gap, no age limit, but must be without gap. What is the average working hours for clinical pharmacist? As per my knowledge, in Canada, USA, or Australia, it's 8 hours, not more than that. They will not keep you in their pharmacy after 8 hours for sure. In India,
No,
you can
maximum is for 40 hours in a week.
40
And
hours
you
in a
work
week.
more than that, yeah, you work more than that, they identify that you're an Indian as well.
Yeah, they'll identify
Yeah.
you. And in India, you can work 18 hours per day. That's different. Saudi Arabia, we are coming up. Sure. Kindly focus on the BPharm people also and give more information. See, we are focusing on the BPharm people. See, who's telling? See, that's what I told in the initial stages of our webinar, that BPharm people are perfectly eligible for CAPS, for PEBC, for all the Dubai and DHA and all the other exams in Gulf, but not for the USA. For USA, they either need BPharm plus 2 years degree, that is PharmD post baccalaureate, or MPharm in pharmacy practice and pharmacology in continuation, or they have to do PharmD 6 years. So in USA, that is the eligibility set by the USA government and USA Pharmacy Board. So you have to be 6 years degree. Okay. Any other questions related to BPharm? Please ask me. I'm here to give all the answers.
B-Farm students, if you are listening to me, I would say that you would find the equivalency exam to be much easier, be it the PBC1 or the CAPS, because this is all about the basics of pharmacy. It's all about microbiology. In fact, you learn more than the PharmDs what they do.
Yeah.
In terms of the equivalency exams, I think it should be very easy for you to navigate, whether it's PBC1 in Canada, CAPS exams in Australia, or even the Ministry of Health exams and all that should be very, very easy for you. B-Farm students, I would say that where you would find difficulty is the second examination, which is the qualifying examination, because you don't get to learn a lot of therapeutics, unlike the PharmDs who get to learn therapeutics right from the second year onwards. So, as Sheba said, a little additional focus. See, Sheba is a bee farm. There was no farm bee during those days. Sheba did a bee farm, and she left a very long back. It's about 20 years now. Anju Kurutu is also a bee farm graduate from India, and they've all achieved a lot. They've all achieved a lot. But over the years, things have changed. Exams have become more difficult. And I would say that you don't have to be let down, but that little additional effort for 1 or 2 years, maybe I would say from your second or third year onwards, you can start incorporating therapeutics, and at some additional time will spent on learning therapeutics should help you navigate all these exams with ease. So you should be happy. You should be happy, and we are here to help you as well. We are here to help you, and you could reach out to us anytime. And you are eligible. You are certainly capable of doing things as well. So don't be let down by that.
Yes, absolutely. And I got one PDF from someone from our uh, student, one of my participant in some other webinar series. I'll share that with you definitely. And guys, see, there are a lot of things, lot of things we used to do. So when do we? Okay, they're asking PBC exam how many times in a year? 2 times. One is January, one is July. Okay, PBC conducts the exam only 2 times. One is in July and one is in January. Okay. When do you conduct webinar about CAPS exam? Very soon, very soon. We have started Rx-Edu today. So we will be coming up with a series of webinars for you guys. I have one PDF that I got it. Akram, thank you very much. TP exams in Kuwait. Yes, we are coming up with that. Only M-Pharm pharmacy practice or pharmacology is eligible. See, might be others also, but it will be really quite tough if you are not studying therapeutics, as therapeutics is one of the major role in the level 2 exams for PEPC or NEPLEX. Okay. Yes. May I know what is the procedure to get Qatar pharmacy license exam? Very soon. Sir, we want webinar regarding the full process and details. Each country. Okay. Okay. I accept this request. We'll be coming up with the full procedure. So we are calling Sirisha, all our experts all again, for these webinar series, all again for the full term, as Kirti and Siba is there. We are calling them all again for the full time 1 hour webinars. Okay, don't worry. May I know what's the procedure to Qatar? We are coming up with this shortly. What time job can we get? Sir, is it possible to go for the... It's okay, it will take maximum 15 minutes for the platform, sir. Can you please show the platform? You are on mute.
Can you hear me now?
Yes, absolutely.
Okay, I'll just show cause the platform to learners over here. So before this, what I want to tell you is, see, there are some training platforms in the US, platforms in the UK, Canada, and elsewhere. Not many, but a few of these training centers. So what happens is students who are educated outside these jurisdictions, for example, students who are educated in India, the Philippines, Pakistan, Sri Lanka, Singapore, Malaysia, and other regions of the world, if they want to navigate these licensure examinations, they try to reach out to these institutions overseas. They normally move down to the place and then they take up a training program, which is about 3 months, 6 months duration, and 12 months duration. So, what happens over here is these institutions are wonderful institutions. They provide a lot of content in terms of real-time case studies, multiple choice questions based on a certain examination pattern. But affordability is an issue of here. They charge enormous fees of here, which is not affordable to all in the student community. So, the platform which I'm going to showcase to you is one of its kind for the first time in India. And this is a platform which we want to open up to learners in India, learners to regions in Africa, the Middle East, and to all those regions where learners are looking forward to affordable solutions. So I'll just take you through the platform. Can you see my screen?
Yes, sir, we can see your screen. Yeah, please go ahead.
Yeah, so this is the web layout, and we've got about 21 modules. We call them as modules. I would like to just take you through the modules as well. I think I'll have to just navigate through this. Yeah, you could see, for example, the first module is called the cardiovascular disorders or cardiovascular module. respiratory, endocrine. And as you browse down the website, you would see that we have about 21 modules. Forget the last one, which is a bundle and the demo, but unlike that, you can see the last module over here is pharmaceutical calculations and biostatistics. So overall, we have about 21 modules. And each of these modules is broken down into submodules. I will just show you a small example from cardiovascular disorders. Okay, I think I'll have to log in as a student over here. Okay. For example, the cardiovascular disorders, you could see under the cardiovascular disorders is the key module. And below the cardiovascular disorders, you've got the submodules, as we call them, or the topics. So below this cardiovascular disorders, you have about 11 different submodules. Now, some of this is there in the syllabus in India and other regions. Some of them you may not find them in the syllabus in India or elsewhere. They pertain to the international syllabus. So you have acute coronary syndromes, coronary artery disease, dyslipidemia, hypertension. And as you scroll down, you have intermittent claudication, Raynaud's phenomenon, and syncope. So these are the submodules. So each of the modules have also got a submodule. And when you calculate the submodules, there are about 121 submodules or topics that are relevant to what is called as therapeutics and pharmacist licensure and overseas examinations. So just let me take you through one of these, something which is interesting. So let's say that we hop into dyslipidemia. Uh, I'm sure that it's quite an interesting topic, specifically with India. So if you see dyslipidemia, if you are a learner, now the first thing is you have an exercise over here. You have an exercise, and then you have what is called as, if you are a learner, if you are not familiar with dyslipidemia, or if you want to refresh your knowledge, you also have what is called as the learning sessions over here. You can see the learning sessions over here. So I think I'll have to take you through a different session over here to share this with you. Yeah, one moment. Okay. Yeah. Is my screen visible now?
Yes, sir, it is perfectly fine.
Okay. Can you see the dyslipidemia screen, if I'm not mistaken?
Yes, it is.
Okay. So here we've gotten modalities which are similar to the international examinations, where first you have an assessment. For example, below dyslipidemia, you have an assessment. The assessment has got a total of, let's say, 66 questions. These 66 questions are, I mean, the total is about 95 questions, but case studies are considered as one question. There could be numerous questions below a case study. So let's say this lipidemia has got 66 questions over here. So what you can do as a learner, you can go through the questions over here. Okay. So you just sign a declaration and you get into the case studies. So yeah, if you could just take a look at this. This is based on an international format. Most international examinations have got 5 choices over here. You can see 1, 2, 3, 4, and 5 choices. And some of them are standalone questions and some of them are case studies. So what we've done here is to give you learners two options. Two options. One, if you're a beginner, if you're a learner, if you're not confident of a certain topic, then probably you could access these questions one by one. And if you are a learner, you can use the hint which is given down below, which gives you an idea of the answer as well. See, as I browsed on, we've given you a hint. So you can just read into the hint, which gives you the certain answer. And let's say you just want to click some answer and go by, you can just move on. So you can keep moving. I'm just doing it randomly. You can keep moving. You can keep navigating questions over here. And this is how you go about learning. Now, I just want to tell you that every question over here, if you're a learner, you have a hint which has got a clear explanation of the answer that is relevant to the certain question. I'll just give you another example of a case study as well. So you can see this is an example of a perfect case study. You could see a case study. So all the relevant information on the case study is on the left-hand side. All the patient's information, allergies, medications, physical examination and vitals, the laboratory reports, all these are placed on the left-hand side. And on the right-hand side, you have the questions that you have to navigate relating to this particular case study. So let's say I just go random. I just click rosuvastatin. Or if I don't know the answer, I can use an hint, which is an education tool, which will clearly tell you what is the right answer and why that is the right answer. So case studies, you can keep navigating them. You can see that the case study on the left-hand side remains as such, whereas you have the next question as well. Okay, this is the next question. So you can keep navigating as such. This is another case study over here. So learners have got the time and flexibility where you can take the questions one by one. You can take your time. You can be a learner. Or if you want to use this as an assessment tool, if you feel that you are familiar with a certain topic, you can just randomly answer these questions. And probably at the end of the day or end of the test over here, you have completed a set of questions, let's say about 83 questions over here. So I just want to randomly move on. Okay, so I've just completed the test. So I could submit the exercise. I just want to know how I performed. So I could always submit the exercise. And as I scroll down, now I could review my questions over here. If I'm a learner, if I've done some mistakes, I also have the opportunity to review my entire session over here. You could see this. When you review, you have the answers that are marked. If you've marked the right answer, it gives you, and also it gives you an explanation over here. If you still want to learn, you could click on the explanation. So each of these questions or case studies have the answers marked in green. If you answered anything wrong, again, as I've marked, I mean, it shows you in red that you've answered in wrong. I mean, the answer is wrong, and it highlights the answer which is right as well. So this serves, and again, if you want to learn more about why this is the right answer, you can go for a show explanation, and it gives you a clear explanation of why this is the relevant answer and why not this. So you have a very detailed explanation about that particular area of the question as well. So this is a method of teaching or training which they adopt in the North American continent, more specifically in Canada and the US. And we've tried to adopt a similar system as well. So again, yeah. So you could use this question bank as both as a tool to assess yourself, as to see where you stand in terms of your understanding of a certain topic. Or if you're a beginner, you can also use this tool as something as a learning tool where you can go one question by the other as well. So this is about the platform in terms of the assessment. And now, let's say dyslipidemia, you've completed the assessment, but still there are some areas where you want to have a better understanding and you want to go about learning more on the therapeutic concepts of here. So here on the left side, we've also incorporated teaching or what is called as a study material. For example, we don't teach you the basics of here. You have wonderful teachers across the country, across institutions who get the basics, and most of the information is already conveyed. So we directly get into the therapeutic modalities. For example, you can see the investigations are very important if you are appearing for international exams, or even if you want to practice overseas, you will have to have some basic idea about diagnostic parameters. You don't have to go into detail. For example, if it is osteoporosis, you'll have to know that the basic criteria is to go through a DEXA scan. And what are the parameters on the DEXA scan where you can confirm the diagnosis of osteoporosis? Some values. So basic information on diagnosis is very important. You may be a B.Pharm graduate or a PharmD graduate. You have to have basic information on diagnosis. Again, you could see something very different over here, criteria for intervention. You can just click on that. You have all the information coming on down over here as to when you have to intervene or what are the criteria to intervene to treat what is called as dyslipidemia. Then you have non-pharmacologic choices. Again, don't forget, even dietary recommendations, lifestyle modification, all these are a part of the counseling that pharmacists have to provide for your patient population. As you navigate down, we go to the pharmacologic choices, as you can see over here. So suppose you want to learn about statins. Here, click on it. You have all the relevant information about statins. And I want to tell my learners here, we are not going to talk about the HMG-CoA reductase enzyme or what the enzyme has got to do. That's all something you've learned in college. Your teachers have all educated you up here. But here, we want to get into the therapeutic modalities of where you can incorporate statins, when they should be incorporated into the treatment regimen, what are the monitoring parameters, and so on. Again, if you want to have a look at the drug tables, you can always have a look at the drug tables. This is very, very important over here. A drug, very common brand names are marked over here. Dosage, very important. Common side effects, rare side effects, drug interactions. Most of the questions in international examinations are from these areas. So this is something which you'll have to be very careful about. So you have drug tables. You can navigate each class by itself over here. If you want to have the new drugs over here, for example, the PSCK9 inhibitors, all the monoclonal antibodies which are used over here in the treatment of what is called as dyslipidemia. So you have all the relevant information, the tables, the drug class, the side effects, the dosage. So it's a lot of learning that needs to be done. And coming down, I just wanted to focus on this area as well. Choices during pregnancy and lactation. There's a specific area in international license examinations where you have questions asked in different modules. So you'll have to be very smart in understanding what are the considerations for treating pregnancy, illnesses or what is called as ailments in pregnancy and lactation. Coming down to another area, if you intend to walk with your heads held high with your physicians or fellow nursing professionals, then probably you will have to have some basic idea about the algorithms of here. So if it's dyslipidemia, what is the algorithm? What is the step-by-step therapy of here? What are the cardiovascular, what is called as assessment factors or scales of assessment? How do you access and all that? All these are some things which, as a PharmD or a B.Pharm, who intends to practice pharmacy specifically as a clinical pharmacist, these are the areas which are very important, which are very, very relevant as well. You can see the next algorithm. It talks about the management of statin-induced side effects, or specifically statin-induced myopathy. Again, you have the algorithms on hand. So just before you go for your ward rounds, if you're a student at college, or if you're practicing in a hospital, taking these algorithms, refreshing your knowledge, and walking in will be great. And finally, if you want to know about the scales, probably I think most of you would have heard about the Framingham Heart Study or the global study, which is nothing but a cardiovascular risk assessment factor. Yep. So you have all these scales just to give you a basic information about a certain topic. So yeah, we have brought everything on one platter. We've got you the question modalities, the type of questions, case studies, type of questions that can be asked in international examinations, areas where you need to focus and study as well. So everything relevant to your education, to strengthen your knowledge, to bridge this little hollow space where you can go for your ward rounds with a lot of confidence with your doctors, with your nurses. It gives you a lot of confidence when you're armed with a lot of knowledge. So everything is brought in over here in one platform. And I would want to tell you that this is a brainchild of a team of pharmacists who have practiced overseas, as I told you. We brought in this over here to India and regions nearby. And it's a child that is for you to adopt. How well you adopt the child, how well you grow along with the child is again left up to you people as well. Yeah. So any questions on the platform, you could probably ask me now. Yeah, Dr. Ajit, it's back to you.
Yes, sir. Yes, sir. Thank you very much. One sec. I think I'm here. One sec. Yeah. Okay. So yes, guys, have you seen that platform? This is just nothing. Okay. I mean, he has shown just the basics. If you enter to the platform, it is vast. Sir has prepared this. Last 4 months we are working on the LMS, the learning management system for all of you. We have come up with a wonderful set of papers, wonderful set of questions, wonderful set of modules. All the modules you must have seen. Okay, let me just take you through once more, nothing else, just once more. And let me tell you that the cost part. Okay, and why it is so much attracted, why it is so much attractive, and why it is so much feasible for all of you. Okay, if you look at the cost, there are the modules. Okay, the entire preparations for your FPG, Neplex, or maybe PBC or CAPS will be done in just 14,999. Okay, entire, and this is for 1 year. You will get the access, entire access for 1 year. You have to complete it. You will get your assessments done. After every module, you will be seeing how much you know, how much you can do, and how much you have learned. Okay, and before that, it is totally up to you if you want to join or not. Just check out our demo. Just log into the website, check out the demo. Okay, and then we have all the modules. If you're not interested in the entire thing, biopharmaceutics just 399. Okay, just herbal medications 99, immunization 299, and infectious disease is quite vast, and cardiovascular is quite vast, and other things you can see, eye disorders 199, cancer chemotherapy 399 just. And this is our launch period, so we are giving you in a very much very high discounts, and you will be the first people who are getting this. First 100 people will be getting this amount, and after that we are going to increase. Okay, the first 100 people will be getting these accounts, these at this amount. Okay, and only cardiovascular and infectious disease, because you are going to get more than, I mean, a lot in these two modules. That's why these are just 2,000 rupees. Otherwise, you will get all in below 1,000 or below 500 rupees. Okay, just explore, just get the demo and see. It is everything you will get inside. Okay, your materials, your question papers, your questions, case, hints, and all the learning material we have set here in this website for all of you. Okay, just so I invite all of you to go through the Rx-Edu CliMed overseas, and please learn, and it will help you. It is a wonderful thing what we got. Okay, this is for 1 year entire module, and if you are going for the particular module, that will be, I think, for 3 months each. I mean, if you are going for the particular module, otherwise you will get the access for entire 1 year to learn and 1 year to complete. So there are more than
So can I
5,000.
just add on something here?
Absolutely.
Yeah, for students of the second, third, and fourth year PharmD or the B Pharm students, if you do not want to burden yourself altogether, I think it's not possible again. So it
Yes,
is my understanding it's going to take at least about 1,500 to about 2,500 hours of learning. At least
yes,
about 2 years is required if you want to really master all these data. So if
yes.
you're early into your second, third, or fourth Farm D, you can take up these modules which are relevant to your syllabus here in
Relevant to
India.
your
Or
syllabus.
the, yeah,
Absolutely.
you
If
could
you are
choose
in third
that
year,
so that,
yes,
yeah, you are going along with your syllabus. But for
yes,
students from the fourth year onwards, the fourth, fifth, and sixth year, I would tell that it's good for you to go for a full package where you are exposed to a lot of therapeutic areas, something that
yes,
you missed
absolutely.
out in the second year, something you missed out in your third year. So fourth, fifth, and sixth year PharmD students, I would suggest you to go for a bundle package. Whereas the
Yes,
second and third year PharmDs and the B Pharm students, I would wish that you take it module by module and take it
absolutely.
along with your syllabus, take it along with your curriculum as well. And I'm sure that it's going to be a value addition to your performance in your regular
Absolutely.
academics as well. I can
Absolutely.
assure you that there will be a lot of recognition from your physicians, doctors, other paramedics who are working with you. It makes a lot of difference for you. So that's
And guys,
my humble
let
opinion.
me tell you very clear. This is not something the book you are getting, or entire text you are getting. You are getting questions. Okay, you are getting the questions with all the solutions, with all the hints, with the syllabus. What you are learning in the question, you will get with the hint and with the explanation. Okay, this is not something you are just getting the material. Material is additional. I'll say we are selling the questions to you. Why we are selling the questions to you? Because these are important for you. These are important to crack the exams. Okay, so you are coming to us, you are getting Rx-Edu, you are joining Rx-Edu, and you are getting all the questions with all the explanations. Each and every question has full explanation. Okay, and material is additional. Material is additional for you. Okay, so you all are invited here for this, and definitely this site is not opening. I think you can try it later. Why can't I open the link? Sir, can you please share the link from your side? I think some problem is there at my side.
You could
Okay.
share the link in the group doc. Yeah, I'll share the link as well.
You share with me in my WhatsApp. I'll be sharing with them.
Yeah, you could share. You could share with them. Definitely. I'll share the link right away.
Yes. And guys, so sir, do we have Manju with us to talk today?
Manju is stuck up in the snow. She sent me a video. I
No
can't just
problem,
click a
guys.
video.
So
So
don't worry. Whatever is remaining, we are coming up with the series of webinars with special countries one by one, and you all are going to get everything from us. Okay. And see, don't worry. Like this is not the only solution we are providing, but along with that, we'll be having mentors, doctors, nurses who will be coming and taking your special classes every 15 days. Every 15 days, we will have the series of live learning also for you. Okay, that will be additional for all of you along with this. Okay, that will be additional for all of you. So please also inform us about German. Okay, we'll see. Someone was asking about Switzerland. Someone was asking about German. We'll come up with the European Union. I'm not very sure, but I'll be gathering some knowledge and we'll come back to you for sure. Okay. Okay, guys, so please, I request all of you to go through the demo first and then only purchase. Go through the demo. If you like it, please purchase it and start preparing for your therapeutics. I'm not saying that pharmacy licensure exam, I'll say start learning for your therapeutics and biopharmaceutics. Okay, so I'm sharing the feedback link all again, and then we can uh, wind up, guys. If you have any questions, please ask the questions, and your certificate will be ready by day after tomorrow. Don't ask me, maybe tomorrow evening we can give all the certificates, but day after tomorrow for sure. Okay, because it takes time for preparing a lot of certificates, so it will take a little time, right guys? It will take a little time, so you can definitely, and your certificate will be delivered in the email, okay, with your full name. So don't forget to fill the feedback form, and don't ask me the feedback form later after the webinar. You have to fill it right now. Okay, so thank you very much, everyone. Thank you very much for joining, and thank you very much, Jacob sir, for this wonderful platform. I'm literally obliged, and I can see one of my mentor, Dr. Mahadev Bhatt, is joining drive from USA. Thank you very much, sir, for joining this early morning, and thank you very much for giving your insights always and your blessings. So you can open your mic, sir.
Can you hear me?
Absolutely, sir. Absolutely. Thank you very much. So, guys, sir is working. Sir has been working in US right now. He's retired, so he has been working in US for almost 40 plus years, 50 years, and he has all the experience in USA. Still, he's in USA. So, sir, please share your experiences. How pharmacists is doing in the pharmacists are doing in the USA, and what you want to give them the message.
Well, number one, congratulations,
Thank you,
Jacob.
sir.
You do have a good command the way you present the things.
thank you, Dr. Mahadev. That's a big compliment from a person like you. Thank you so much.
And now I'm retired, but I do a lot of consultation, One thing I like to say that so far as I know, nowhere in the world, if you work in industry, you need to give any exam. So far as I know, because I consult almost 6 different countries, and I talk to them. But whenever you are going to get involved with a consumer directly, because then the liability comes, and the state would like to find out how far you are competent, whereas this thing is not in India. Okay. So, there are a lot of ways you can do the things, but I'm glad that Dr. Ajit has started this program. Every time I join in, he has got something new up his sleeves. And this is a good thing. This is a great thing. And I'm quite sure that there will be other modules will be coming up, because Dr. Jacob and Ajit, they both know that practical training is a great asset,
Yes,
And
sir.
here in the United States, in a pharmacy, community pharmacy, we wait for interns to come because intern has got a license. biometric things, and from second year onwards they work till they get graduated. The NAPLEX and all, those are the exams that you are eligible or not. But every state has got an individual exam to get a license. I'm sorry, Jacob, I'm not disagreeing with you, but generally everybody says that my country is the most difficult, and the Canadian will always say that we are the most toughest.
I get you, Dr. Mahadev, yeah. But that's from
And
experience, that's it, yeah.
yeah, and the Britain people from the Britain, they will say that they are the toughest, and I will always say that California is the toughest.
I
So,
agree with you. No arguments here, no arguments at all.
but basically, that how much do you love what you do? Then nothing is tougher.
Exactly.
Look what Dr. Jacob has done. Look what Dr. Ajit has done. Has opened up a new avenue. So everybody has a chance to do that. So I'm very happy.
Dr. Mahadev, I just wanted to intervene here. I've seen people, they've talking about 2,000, 3,000 students coming down for international exams from 120 different countries. And the training programs overseas, they charge about 1 to 1.5 lakhs Indian rupees, roughly about $1,200, $1,300 for 6 months or 8 months. And this is something which was not affordable for everybody. So when I got to interact with Dr. Ajit, that was the criteria I set forth. I said, we will bring in all the same content. We will bring in content which is quality and both got quantity as well. We will bring this, but only on an affordable platform. That was the basic idea.
And you can find enough mentors and people can talk to them directly.
Absolute,
Since
absolute.
I talked to Ajit, once a month or something like that. Lately, I have
Yes.
been getting a lot of WhatsApp messages from the students, and I do reply them. And so this is a great thing. I think you guys are going to change India, the way pharmacy is practiced. Congratulations.
Thank you,
And
With your
sir.
I'm
blessings, thanks a
always,
lot.
thank you. Thank you, Ajit
Thanks a lot,
sir.
sir. Thank you very much.
Thank you,
Thank you,
Doc.
sir.
Thank
Thank
you.
you very
Thank
much.
you.
So, guys, thank you very much for joining us. And it's almost 9. So now we can wind up. I have shared all the forms here, all the websites. Please go through and join us,
Doc,
learn
I've
from.
also shared the website link. You can just share it with them
Sir,
as
I've
well
shared, I have
on
shared, I have shared
On
already.
your WhatsApp.
Yes,
Yeah.
yes, shared. I've shared all here.
Thank you. Thank you. Thank you.
I've shared all here. Yes, sir. And guys, thank you very much. And we are coming up. If you want to join us, please join our WhatsApp and Telegram channel we have created for CliMed Overseas exclusively. Please join us, and you can learn from that. And we will be updating you a lot of quizzes, lot of things. And we have the Instagram channel also. If you are there, you can join Instagram channel, so you can get information from anywhere. Okay. So thank you very much, guys. Thank you. Have a good night. Bye bye, guys. Bye, sir. Have a good
Thank you,
day, sir.
sir. Bye-bye. Bye.
Bye
Bye.
bye
Bye.
bye, Jacob,
Bye.
sir. Bye.
Bye.
Bye bye.
Bye.
Good night, everyone. Good night. Bye bye. Sir, one more question answer. Acha, okay. Guys, so this question I'll take later. I think Mr. Jacob was supposed to answer. Yeah, 1 year session. I mean, okay, sir, if I buy the bundle, then two for only 1 year validity. Yes. Each module have only 3 months validity, and the entire bundle has 1 year validity. Yes, guys, so it is very clear. 1 year bundle has one, I mean, the entire bundle is 1 year validity, and each module, if you buy it, is 3 months validity, but that will cost you higher. Okay, sir, how to get license in Canada or USA? Applying right after graduating without much delay. See, first of all, it will take 6 months at least to evaluate your documents, including license. So 6 months, so definitely it will take, and then you have to wait for the exam. And if you are eligible enough, if you are brilliant enough, you can crack all the exams in one go. That will take 1 year, additional 1 year. So at least 1.5 year. I mean, 12 months to 18 months. Warsi, you need. Okay. Okay, so I have shared the feedback form all again, and I'm sharing it all again, guys. So, and later it will not be shared. So thank you, guys. Take care. Please fill the feedback form, everyone. Okay, like I'm a student of Masters of Pharmacy in Pharmacology and also a clinical research associate with 1 year experience. Now I'm trying for a role in UK. Definitely, thank you. You can please try. It's a good idea. Being a CRA is wonderful. Yes, everyone can leave. Thank you very much. Please fill the feedback form and leave. Yeah, I'm just waiting for people to fill the feedback form. So guys, take care. I'm also leaving. Thank you.